Vaginal bleeding when you first start hormone replacement therapy. Hi, if you're new here, I'm nurse practitioner Tanika, and I talk about hormone health, functional medicine, and real answers for women's health every week. So be sure to follow. So let's talk about something a lot of women ask: vaginal bleeding when you first start hormone replacement therapy. The first thing to know, it's really common. Light bleeding happening in the first 1 to 3 months happens pretty often. This is because your uterine lining is adjusting to new hormones, and sometimes that means it sheds a little. If you're perimenopausal, your ovaries are probably still functioning. That means you can still have periods until you fully transition into menopause. If you're menopausal, meaning no periods for at least 12 months, you may have no bleeding or just very light spotting. Your clinician will want to know how much bleeding you're having. Sometimes we'll tweak your dose or order additional testing. But here's what's not normal: heavy bleeding. If you're soaking a pad or tampon in an hour and you're feeling lightheaded, that's an emergency. Go straight to urgent care or the ER. Now, if you're bleeding and it's light, but it's just annoying, you can often stop hormones temporarily and the bleeding will settle down. The bottom line: some spotting is normal at first, but heavy bleeding is not. Always follow up so your dose can be adjusted or further testing if needed. Was this helpful? Share with a friend who's starting hormone replacement therapy and drop your questions below. Always remember, you are in charge of your health. Don't ignore your symptoms. Be sure to follow, as I'm always here to break things down for you.